Good morning, everyone, and thank you for having me today. The research that I'm going to present formed part of my master's in psychiatric research at the IOPPN. Functional neurological disorder, henceforth known as FND, is a prevalent and often disabling condition, affecting approximately 50 in every 100,000 individuals, and presenting with disruptions across motor, cognitive, and sensory domains. Symptoms may include, but aren't limited to, seizure-like episodes, problems with movement and cognitive function, as well as sensory alterations. FND may significantly interfere with how a person is able to lead their life. Previous research has highlighted that FND has disabling effects similar to that of other major neurological conditions, and with comparable levels of symptom burden and impact. The diagnostic classification of FND varies, with the DSM-5 categorising it as a somatic symptom disorder, whilst the ICD-11 positions FND within dissociative disorders. This mismatch reflects the ongoing debate around its underlying mechanisms. Clinical and experimental studies have shown that dissociation in FND may be linked to emotional dysregulation, autonomic alterations, and disrupted interoceptive awareness. Dissociation is a term describing a discontinuity in the usually coherent processes of memory, consciousness, and identity. There are various types of symptoms of dissociation which fall broadly into two categories. Psychoform dissociation is a disruption to the mental processes, and somatoform dissociation manifests as physical, motor, or sensory disturbances that lack a clear medical cause. There is an increasing amount of evidence to suggest that dissociation may be implicated in the underlying mechanisms of FND. This slide highlights the strong link between dissociation and FND. A systematic review by Campbell et al. Showed that people with FND experience higher levels of psychoform and somatoform dissociation compared with healthy and neurological control groups. They also tend to have a greater baseline dissociation and may have altered interoceptive accuracy or awareness, especially after dissociation is triggered, which was found in a study by Pick et al. Importantly, Lysenko et al. Found that dissociative symptoms in FND are comparable to those seen in post-traumatic stress disorder or depersonalization, derealization disorder. Campbell et al.'s systematic review also evidenced a high rate of comorbidity, with between 8 and 80% of people with FND meeting diagnostic criteria for a dissociative disorder. Overall, this evidence suggests that dissociation is a key feature and potentially important mechanism in FND. This study used smartphone-based ecological momentary assessment and wearable devices to track dissociative symptoms and their possible predictors in daily life in people with a diagnosis of FND. The study incorporated wearable heart rate monitoring, which allowed for comparison between subjective and objective markers of arousal as predictors of dissociation. This dual approach was motivated by prior evidence of potential disconnects between physiological and subjective emotional responses in FND, suggesting that emotional experiences may not always align with autonomic states. The hypotheses predicted that, compared with healthy controls, individuals with FND would report higher levels of dissociative symptoms in daily life, specifically amnesia, depersonalization, and derealization. In addition, it was predicted that moment-to-moment increases in these dissociative symptoms would be associated with or predicted by heightened negative affect, greater subjective physiological arousal, and increased heart rate. The present study is a secondary analysis of data collected during a previous digital remote monitoring technology study, published in 2024. The original study was designed to collect data on a variety of momentary symptoms from individuals with FND, with the primary aim of assessing predictors and correlates of FND symptoms in everyday life. Extending this, the present study analysed a subset of data to assess potential predictors of momentary dissociative symptoms in this sample. The study enrolled 17 individuals with FND, with either functional seizures or motor symptoms, and 17 healthy controls matched for age and gender. Clinical histories were carefully screened, excluding individuals with major neurological or psychiatric comorbidities to reduce potential confounds. Participants received smartphone-based EMA prompts 8 times daily between 8 a.m. and 10 p.m. The prompts were on a pseudo-random schedule, with an average interval of 1 hour and 45 minutes between them. The questions posed were derived from validated scales, including the clinician-administered dissociative state scale and the positive and negative affect schedule. Data was collected on 3 types of dissociative experience: dissociative amnesia, depersonalization, and derealization. This slide shows the demographic characteristics of the FND group compared with the healthy control group. These groups were broadly similar for ethnicity, relationship status, and education beyond 16 years of age, with no significant differences in these areas. However, as we might expect, the FND group had significantly higher rates of both mental and physical health diagnoses, and higher numbers took medication, with significantly lower rates of employment in the FND group versus the healthy control group. Multi-level models were used to analyse between group differences. These found that individuals with FND experienced significantly higher levels of all 3 types of dissociation. These findings are consistent with prior meta-analytic evidence that positions dissociation as a potentially prominent feature of FND. These analyses withstood being controlled for anxiety using scores from the GAD-7. However, none withstood being controlled for depression using the PHQ-9. The PHQ-9 attenuated all group effects, particularly for amnesia, where PHQ-9 rather than group was a significant predictor. However, depressive symptoms did not significantly predict depersonalization or derealization. In the table on the right-hand side, results for the concurrent models wherein predictors were examined separately are displayed. Negative affect, heart rate, and subjective arousal were all significantly correlated with the 3 dissociative symptoms in the FND group. These results withstood Benjamini-Hochberg correction. When entered in a combined model, the results for which are displayed in the figure on the left-hand side, heart rate did not remain a significant predictor. Negative affect shows consistently larger beta values compared to arousal, suggesting that negative affect is a stronger predictor of dissociative symptoms. In particular, the strongest association is between negative affect and derealization. Arousal also shows positive associations with all 3 dissociative outcomes, although the effects are smaller. These analyses retained significance when controlled for depression and anxiety using the scores from the GAD-7 and PHQ-9. Analyses of the healthy control group did not lead to significant findings, and nor did the time-lagged analyses that were conducted. These findings suggest that dissociation in FND is a dynamic process that is closely linked to negative emotional states. In particular, momentary increases in negative affect and subjective arousal were also associated with increases in dissociative experiences. The absence of time-lagged effects suggests that dissociation tends to occur in close proximity temporally to emotional changes, rather than emerging as a delayed response. These results align with neurocognitive models of FND that propose disruption in the integration of emotional, cognitive, and bodily signals. Previous research has shown that individuals with FND may report heightened emotional experiences without corresponding increases in physiological arousal, sometimes described as a mind-body disconnect. The dissociation patterns observed here may reflect similar disruptions in how emotional and bodily signals are integrated. Clinically, this highlights the potential value of interventions that target emotional awareness, managing levels of arousal, and grounding strategies to reduce dissociative responses. The limitations of this study should be noted. The sample size was small, which does limit the statistical power and generalizability of the findings. The reporting period was only 1 week, as the main aims were to test the feasibility and acceptability of the methods prior to a larger scale study. Finally, I'd like to thank Dr. Susanna Pick, who designed and led on the original study and supervised these analyses, in addition to all of the collaborators and the participants who were involved in the study. Thank you.
Thank you. Thank you, Amy, for that. It's very interesting. So we can take one question, maybe. So there's one up there, actually.
Thank you very much for that fascinating presentation. I was going to ask whether you're going to be linking those findings to the ongoing and developing work on interoception, which has been associated with a number of associated states like alexithymia, and also has computational modelling associated with it, from which you could draw predictions and help manage future studies.
Thank you. I think that's a really good question. So at present, the study that I've presented will contribute to a larger scale study. The original study was a feasibility and acceptability trial for the EMA data collection method in a cohort of people with functional neurological disorder. So I think that's definitely something that we could look to for the future, but at present it's a larger scale study of the same kind. Thank you.
Well, thank you.